Oral surgeons and dentists assist in the rapid screening stations in communities to ease the overwhelming medical capacity. The volunteers in the Philippines help relieve the disease sufferings of a 5-month-old baby and a breadwinner of a family.
歡迎收睇DaAi Headlines， 我係 Ruby 5，我哋一齊嚟睇下今日嘅內容。To contain the novel coronavirus, several screening stations were set up across Taiwan to provide rapid tests for people in need every day. Yet, the medical capacity of the stations is quite tight. Hsu Po-Chih, an oral and maxillofacial surgeon, actively joined in the rank to assist in screening. Also, more than 300 oral surgeons and dentists were recruited and trained to get prepared for helping out in various screening stations.
The screening station of Dalin Tzu Chi Hospital takes up the needs of the community residents and links them with the medical referrals if necessary.
If the result of the rapid antigen test is positive, we'll give the person an N95 mask. We'll also ask him to return to his home, try to stay alone in one room to wait for the PCR test report. If the PCR result is positive, the Department of Health will send him to the quarantine center. For those with negative rapid screening result, they are also required to go home and wait for a PCR report.
During the pandemic, the number of patients undergoing emergency operations decreased. Hsu Po-Chih, who is the attending surgeon of oral and maxillofacial surgery, immediately went to the screening station to help ease the tight medical capacity.
I came to assist physicians to screen these patients so that they can receive medical treatment as soon as possible. The maxillofacial surgeon is originally responsible for the treatment of head and neck cancer. For us, screening actually covers the places we usually come across.
The doctor collects the specimen precisely, yet the virus is pervasive. Even professional doctors are still with great caution.
In fact, we surgeons usually pay much attention to the concept of sterilization. We have already developed the habit of disinfection or sterilization every day before conducting consultation. After work, before we go home, we must carry out disinfection procedure. So basically, our family members are used to this practice.
The Taiwanese Association of Oral and Maxillofacial Surgery made a public appeal, calling on more than 300 surgeons of the same specialty to help out in the frontline rapid screening, relieving the overwhelming medical capacity. After undergoing online training, oral and maxillofacial surgeons pass on their experience to the participating dentists, hoping to assist in the screening stations in community.
Dentists usually take care of the condition of the oral cavity. We will especially strengthen their skills in nasal screening. For the past 2 weeks, 1 week we had the Taipei Dental Association, while the other week we had the new Taipei City Dental Association. There are almost 200 dentists join in each session. For 2 sessions, there were 400 dentists in total. The content of these audiovisual teachings will be left for other dentists to watch, so it will gradually spread out and more dentists will join in.
Masks, goggles, and face shields make the whole body airtight. The first-line healthcare workers willingly stand on the front line to safeguard the health of the community residents.
In response to the increasing number of people diagnosed with COVID, Dalin Tzu Chi Hospital has made suitable adjustments to receive COVID patients. Apart from adding 10 dedicated wards, the concept of lean management has also been implemented to make patient care more efficient and reduce the risk of infection, ensuring the safety of patients and healthcare workers.
那我们带病人进来的时候，先开门，然后告诉他打叉的这个衣柜不要做使用。那病人的行李区的话，可以让他先把行李放这边。
Marking floor lines in different colors and incorporating lean production concepts in healthcare, Dalin Tzu Chi Hospital opened 10 additional dedicated wards with 10 beds in response to the epidemic prevention policy.
Taking care of such patients, everyone will inevitably be under pressure. Lean production can make taking care of patients more efficient and reduce the chance of infection of our colleagues.
In our epidemic prevention ward, including all traffic flow lines, any process or action, we have implemented the lean healthcare management process to protect the safety of all patients and all staff.
There are 3 shifts in the ward every day, with 3 to 4 healthcare workers during the day and 2 nurses staying in the night shift. The hospital also prepared a message board at the windows to let the patients communicate their feelings.
If a person stays in the ward alone, he may feel bored. We will try to provide a place for him to write things, allowing him to have some leisure time.
The healthcare and administration workers cooperate together in order to maintain the safety of the anti-epidemic frontliners and also take care of the anxious feelings of patients.
In addition to physical pain, COVID-confirmed patients often face with various changes in life. At this time, social workers play an important role in providing companionship and care to them. Recently, a father and son were contracted COVID and admitted to the hospital together. After that, the son lost his job and his father passed away. Fortunately, a social worker took the initiative to care and sent supplies to help him get through the difficulties.
In the recent pandemic, many confirmed cases were infected through families. An 80-year-old man developed cold symptoms, followed by a similar situation with his 50-year-old son, who lived with him. This diagnosis was confirmed after screening, and the two were admitted to the same hospital for the treatment. But his father's symptoms continued to worsen and finally passed away.
His son was very sad and cried. He even blamed himself for not taking good care of his father. He should not let him go out to buy grocery or cook.
The social worker learned that, in addition to facing the terrible news of his father's death, the son actually suffered financial problems after he was confirmed COVID and admitted to the hospital.
When he was admitted to the hospital on the first day, the company told him that he would find someone to replace him, and later told him that he didn't need to go back to work anymore, which meant he was fired.
After 14 days of treatment, the son is ready to be discharged from the hospital, and the social worker also applied to the Tzu Chi Foundation for emergency relief and supplies for him.
He told me that I only have a few $100, and I can't even pay for the taxi. What should I do? I said it's okay. I've already applied for emergency relief for you, so we gave him the cash that can be used in time. Tzu Chi Foundation has an epidemic prevention living box, which is no longer called a bag, but a large box of items, so that he can make simple food at home to eat.
Upon receiving everyone's love, he felt the warmth of the pandemic. After he returns home, the social worker will continue to care for him.
Apart from providing medical service to the COVID patients, Tzu Chi also provides 6,000 care packages, each of which contains nutritious food and spiritual publications for the Taipei city government to send to people in home quarantine. Tzu Chi employees work with one heart, completing the package in just 4 days.
How to quickly pack 6,000 care packages neatly, a good plan is needed. Some are prepared in the goods, some are packing them. All have a good understanding of each other.
At the beginning, everyone must first learn how to arrange the resources, then it will become smoother.
During the severe pandemic, protective measures are necessary. Wearing a mask and face shield, resistant discomfort and sweating, just to pack the assistance.
It is very hot, but we need to protect ourselves, and then we can help others. So we still have to do this.
Each pack contains Jingsi instant noodles, 5-gram powder, buckwheat tea, sauce, white rice, spiritual publications, all prepared for people in quarantine. Tzu Chi people mobilized to help.
The care package is mainly done by colleagues from DaAi Tzu Chi chapter. It is estimated that about 20 colleagues can do packaging each day. It's estimated that 1,500 will be packaged each day in 4 working days.
After the packaging is complete, it will be distributed by the Taipei city government to help people in quarantine so that they can feel the most sincere care without leaving their homes.
During the pandemic, almost 2 volunteers in the Philippines continue to care for people in need. Recently, they have helped 2 patients suffering from illness undergo emergency operations. One is a husband who is the breadwinner of the family, while the other one is a 5-month-old baby. 2 volunteers relieve their pain with medical assistance, bringing hopes to their families.
5-month-old William, who was lying quietly in his mother's arms, seemed to have no difference from other babies. Yet, he suffered from hydrocephalus, causing his head to be much bigger than average.
Before, William always cried and didn't have normal bowel movements. Watching him suffer really broke our hearts, as we could not bear the pain for him. From his cries, we knew he was suffering greatly.
Jaylin was helpless in face of her son's difficulties, so she asked the volunteers in Great Love Village for help. Apart from assisting William to go to Tacloban for surgery, the volunteers also visited the family many times after the operation.
Compared to his condition before the operation, his head has gotten smaller, and he does not cry that much like before. When we play with him, he would smile. We are really grateful for Tzu Chi's help, otherwise my child wouldn't be like this now.
Another one who also suffered from disease is Nanito, who grows sugarcane for a living and is the breadwinner of the family. Yet he suffered from severe swelling in his scrotum, which has plagued him for many years. It was until he met Tzu Chi that the problem was resolved.
I didn't expect someone would be willing to fund my surgery expenses and help me solve my long-lasting pain. My condition is getting better and better, thank you.
After undergoing the surgery, my husband can go back to his normal life. Now he can walk without any difficulties and work smoothly, which is not like before, when he was always bothered by his disease.
The breadwinner of the family has recovered from illness. Volunteers send the family living supplies and blessings, hoping that they can lead a better life in the future.
The pandemic in Thailand continues to spread, and the lives of refugees are unsustainable. So the volunteers have taken protective measures to pack food and daily necessities, which were then sent to more than 1,000 refugee households in the form of house-to-house delivery.
Jinsi Ho in Bangkok is filled with all kinds of daily necessities. The Tzu Chi volunteers have also taken protective measures to pack them. The pandemic in Thailand continues to spread. The lives of refugees are unsustainable. Therefore, volunteers have been distributing supplies every day since the beginning of June.
Today, we distributed supplies to 205 households, and we will continue to distribute them to refugees on the 8th and 9th of this month. About 1,000 households are about to be distributed.
During the pandemic, it is impossible to gather in groups. Volunteers are divided into 3 groups, and according to the number of the refugees in each district, food and daily necessities are delivered one by one.
It's very useful because it's very necessary for us to cook every day, and these are the very necessary food bags, so food items we can use more than a month.
Thank you for this good group, and the group have a good work, and thank you too much because you are have hard work. They carry the food and carry flour and anything.
We cannot go anywhere because of it. Someone coming to my area, this and help me and make the me more than help we need. And thank you so much.
Volunteers deliver living supplies to communities where refugees live and then distribute them to the disadvantaged families in need. Although the pandemic has blocked everyone's social distance, love has broken through this barrier.
The influence of the media is very broad, as any information can be spread with just a touch of a finger and technology. Tzu Chi Foundation established the Tzu Chi Monthly in 1967 as a way to have a public record of the donations received, but then it later served as a way to spread Tzu Chi's message of good. It changed from black and white into color, and from print copies to a digitized magazine in 3 different languages. In 1998, DaAi TV was born and was the beginning of purifying society through a stream of media content filled with righteous thoughts and uplifting messages in a chaotic society. Follow our reports as we learn more.
Wang Mianmian is a Burmese youth whose life was changed due to her interest in reading a Chinese magazine.
I like Chinese because learning Chinese is interesting. My first encounter with Tzu Chi Monthly is because I was volunteer with Tzu Chi. There is a liaison office nearby, so we regularly receive the magazine.
Wanting to learn Chinese, Wang Mianmian, who was born in Myanmar, used the Chinese version of Tzu Chi Monthly as a learning tool. In the end, she even became a contributing member of the magazine.
In the beginning, I was helping to translate, and then Tzu Chi began building a school there. Yes, I started as a translator, and later seeing my name on the magazine gave me such a sense of accomplishment.
Due to the length of time for mail when the Chinese Tzu Chi Monthly arrives in Myanmar, it's past the prime. But Wang and her co-workers still treasure each issue, to where they even started their own reading club for the magazine. To strengthen her Chinese, Wang chose to study in Taiwan, and now she's nearly complete with her studies and has found a future direction in life.
I want to be a children's teacher, a Chinese language children's teacher. So I've begun to apply, and if I pass the interview, then in July, and the pandemic is eased, then I will go to Indonesia to be a Chinese teacher.
Tzu Chi Monthly's first issue was printed on July 20th, 1967. The premiere run was 3,000 copies.
Tzu Chi Monthly was just a single sheet of a spread of newspaper print. It was a bi-monthly publication, and the most important aspect of it was for credit documentation.
6 years after the initial publication, to make it easier to read and save, it was changed into a magazine on August 5th, 1973.
创刊号的时候，其实这里面发刊词上人他其实就有讲到说
In the original print, Master Zheng Yan wrote a speech which said each word printed in the Tzu Chi Monthly is not to go to waste. It's to benefit sentient beings, and doesn't go against Tzu Chi's values. To this day, these 3 sentiments have not changed. This publication is a way to purify the tainted spirit and is the foundation of a harmonious society. It can help to save those who are suffering and be a force of stability in this hectic society.
甚至在癫狂慌乱的现代社会，我们希望能够做一个正面、大正面。
As new media began, the Tzu Chi Monthly went from newspaper to magazine and changed from black and white into color. Now it heads into an innovative era.
很早之前，我们开始响应环保减量的时候，
We began to reflect on our own environmental protection efforts early on. Our print copies started from 300,000 print copies and gradually reduced printed copies and began digitizing the magazine. We then began promoting e-books, as we have always made our magazines into PDF files so volunteers can access it at all times.
To digitize the magazine, which has been printed for over half a century, has been a huge undertaking.
Going digital means we can reach more countries faster. In paper format media in Taiwan, it can take up to 1 week to get into the hands of readers, but since going digital, when we publish, the readers can access the content the very same day. As for our overseas readers, media on paper format may take 2 months to reach them.
The digital copy of the Tzu Chi Monthly gives overseas volunteers immediate access, and also 3 different languages to read: Chinese, English, and Japanese. These volunteers in Hainan have nearly gotten to know Tzu Chi through DaAi television.
Participating in recycling efforts has changed my outlook on life. My temper no longer flares up.
DaAi television has been established for 23 years, and it began broadcasting on January 1st in 1998, establishing itself as a one-of-a-kind programming.
在当初成立的时候，是遭到最大的阻力，不是顺。
When the master wanted to begin a television station, she was met with tons of opposition. Everyone was against it, and told her a television station was one that needed tons of funding, and the burden of it is very heavy. However, I know Master Zeng Yan was very clear in why she wanted to establish such a channel. She wanted a channel to provide a stream of purity and was something society needed.
排除众议坚持要做一个清流的电视台。字我觉得是一个关键字，对媒体发展，或者甚至对于媒体。
I think there is one keyword here, and that is harmony. This keyword is important in all aspects, such as media, humanitarian, arts, and technology. It's especially important in Tzu Chi because we have our 4 main missions and 8 footprints to follow, on top of which there are media volunteers all over the world, in over 120 countries, who help to document Tzu Chi's history. When they create history to document, we also document the history they create.
能够做记录，他们创造了历史，写下了历史，我们也把历史记录下来。
When the real-life stories of suffering and happiness are broadcasted on television, it may serve as a way of healing for some people.
心理层面的问题，他因为忧郁症去自杀，造成一些肢体。
He suffers from emotional problems such as depression, which led him to suicide. That attempt injured his physical body, which then caused him to be bedridden for life. Of course, mental health has no short-term cure through our care and companionship. However, I hope he can find a different perspective through watching DaAi TV and the Dharma wisdom it offers.
一个内容，然后去能不能改变他的想法。
From print media to videos, through modern technology, Tzu Chi continues to light up forgotten corners and helps to provide guidance where it is needed.
In view of the severe pandemic in Taiwan, Tzu Chi volunteers in Dallas, the United States, took the initiative to pack 3 containers of anti-epidemic supplies to be shipped to Taiwan for the frontliners to fight against the pandemic. We'll leave you with these images. Thank you and see you next time.